This is a CRS onboarding module, Managing Study Documents. Managing your study data. In this module, we will discuss what exactly is study data, when should you begin collecting your study data, who should collect study data, and where should it be stored. Objectives are: review components of the subject research chart, provide some tools to prepare for the first visit, differentiate between protocol deviations and violations, understand source documentation, and provide tools for completing case report forms. What is study data? Data is a series of observations, measurements, or facts. Data can include documents, direct observations, previously documented information like medical records, calculated information like lab results. Any piece of information that contributes to the who, what, when, and how of the study. The subject research record should tell the subject's story. It should capture all the data needed to achieve study endpoints, document informed consent process, it should be traceable, and it should verify the authenticity of the data. Subject research record should have 5 sections. Section 1, Administrative Documents. Section 2, Subject Visit Notes. Section 3, Log Notes and Cumulative Records. Section 4, Blank Documents and Worksheets. And Section 5, Uncompleted Visits. Section 1, Administrative Documents, is where you will document the consent process, keep a copy of all consents and assents, the questionnaire if applicable, the participant's demographic information, all medical release forms, custody papers, and progress notes. Remember, if it is not documented, it didn't happen. Here's an example of the consent progress notes and of a study questionnaire. Section 2, Subject Visit Notes. This is where you will document who, what, where, when, and why of the participant visit, all source documents to complete CRFs, develop checklists for study visits, and all labs, test results, and procedures. Section 3, Log Sheets and Cumulative Records. This is where you'll keep records used to capture information needed for all participant visits, like adverse events, concomitant medications, a drug accountability log, and all calendars. Section 4 is where you'll keep blank documents and worksheets. And Section 5, Uncompleted Visits. Some general tips and tools. You can use different colored paper to differentiate between different visits or different types of documents. Use Outlook task lists for appointment reminders or phone calls. Never leave anything blank, either put not applicable or not done. Take time to review the information after each visit and call the subject if the information is unclear or incomplete. Develop worksheets, contact lists, and checklists. Your goal is to provide a how-to for any coordinator. Here's an example of a lab processing sheet for Visit 1. Here's an example of a study checklist. For these and many more forms, please click on this link or email us at crshelps@nationwidechildrens.org. Thank you.